Hi, Mohammed. Thank you for
Hi,
joining
Vicky.
us today. How are you?
Thank you. Yeah, I'm okay. How are you?
Good, I'm good, thank you. So it's evening your time, isn't it? What time is it? It's a Friday.
Yeah, it's a Friday evening. It's 8:30 p.m., which I guess is 11 hours ahead of you guys
Yeah,
in the UK.
yeah.
Yeah.
So you're just getting started with your weekend. So can
Yeah,
you tell us a bit about yourself? You went from the UK to Australia as a GP. Tell us a little bit about how you made that journey.
sure. So, yes, my name is Mohammed. I am a GP who trained in the UK. I grew up in the UAE and I went to medical school in Sheffield and I did my GP training in London. And shortly after I CCT'd, I made my move to Australia.
And so where in Australia did you choose to land?
Yeah, so I chose somewhere that reminds me of home, sunny and warm. So New South Wales. So I actually am an hour south of Sydney in a small city called Wollongong, which is pretty
Mhm.
much the best of both worlds. So it's close to Sydney, like a major city, but also has the calmness and the laid back sort of atmosphere of a small city, which is quite nice.
Yeah. Sydney, people ask about Sydney and then they find out it's not DPA, which is where you have to work if you're a UK GP making the move. So I do speak to them about Wollongong, and yeah, that's one of the things I
Yeah.
say, that I do think you can get the best of both worlds. You're close enough to Sydney that you can go in and yeah, enjoy everything it has to offer, and then have a little more relaxed life in Wollongong.
Yeah, and in Australia terms, 1 hour is nothing. It's like a very
Yeah,
small journey. So if you want to
yeah,
make frequent trips to Sydney, it's nothing.
yeah.
Yeah.
I have actually driven to Sydney from Wollongong on one of my trips. I drove the coastal road, and what a beautiful drive it was. It
It
was really
is.
nice.
Yeah, yeah,
Yeah, it's gorgeous to do. And so, what motivated you to make the move from
yeah.
the UK to Australia?
Yes, it's pretty much what you said, Vicky. It's just the atmosphere, the environment, like the natural beauty of the place is one of the major reasons why I moved. And it allows you to do a lot of outdoors activities, hiking, swimming, surfing, whatever you'd like. Also, moving from the UK, it's quite easy to come here because they recognize the training and all the hard work you've done in the UK. So, as soon as you do all the paperwork, you don't have to go to sit through any exams. You just kind of apply, and a few months later, you're here. So it's pretty straightforward.
Yeah. So, how did you find doing the paperwork to get there?
Yeah, so thanks to Grace, who works at Head Medical, she's one of the registration consultants. She really helped me throughout the whole process. It is quite a convoluted process, like the whole GP paperwork, APRA, but she really was really well versed in all of that, and she kind of, talked me through it, and she made the process so much easier. So really, like, hats off to her for helping me out.
Yeah, we do get a lot of good feedback about the Reg guys. Yeah, taking a lot of the hard work out of the paperwork and guiding people through it. So,
Yeah,
but it's always good to hear.
yeah.
Did you have any concerns before making the move? Was there?
I was pretty excited to come here. I knew that I wanted to try somewhere else. Given the way the NHS was heading, I thought, you know what, let me go somewhere that appreciates doctors more and like where the culture is happier in a way here. So yeah, I was pretty happy, and also having Grace and like having for health to help, sorry, medical head medical to help me with the whole move actually made it so much easier. So I was not really worried about anything.
Yeah. So it's one of the four health practices that you've gone to.
Yeah,
And have they been quite a good move and
yeah,
supportive? You find that a good
yeah. They've been very
choice?
supportive. Yeah, yeah. They've been very patient with me, very supportive. They were very understanding. They answered all my questions, and Jordan, who was the talent resource manager, he was also alongside Grace, was very helpful to me, and yeah, they made everything so much easier
And so what have you found are the biggest differences working as a GP in the UK, in Australia, sorry, as
in
opposed to the
Australia.
UK?
Yeah, so the biggest realization is over here in Australia, you are treated as a sole proprietor, so you are your own business, and in that sense, you are in charge of your own hours. I mean, of course, you have if you're working full time, you have to work the 40 hours as a minimum, but you can negotiate with the practice and tell them which hours you want to work. For example, for me, I'm an early starter. I like to finish early and sorry, start early and finish early. So I start at 7 a.m., finish at 3 p.m. So then I have the rest of the day to myself. So this really gives me a good work-life balance. So I'm able to do things that I like doing after work while the sun is still up. And
Hmm.
yeah, so it's been quite good.
And one of the things that people ask us about making the move from the UK to Australia is the earnings, because it's the fee for service model, as opposed to salaried. And that's something that I think people initially kind of struggle to get their head around a bit. How have you found that?
Yeah, I think it's a very good model to follow. In a way, it shows that they respect the patient's the doctor's time. So the longer patients spend with you, the more you can bill them, the more you can charge them. So I think it's a very good initiative to, or a very good way to reward the doctor for working harder.
Yeah. And I think you've mentioned before that sort of you do the admin while the
Oh yeah,
patients are there. That's like built into the appointment, isn't it?
yes, that's
Um,
true. Yeah,
yeah.
yeah,
And people say that it's sort of similar to being a locum in the UK. Um, would you make that comparison? What comparisons would you draw, or what differences?
oh yes, pretty much. You have the freedom of a locum in the UK, but you also have the stability. Over here, you know that you have a job in the next,
Hmm.
1, 2, 3 years. Whereas as a locum in in the UK, you're not sure if you have a job tomorrow, next week,
Yeah.
the next month. So you have all the perks of being a locum here in
Hmm.
Australia with the stability.
Yeah. So is it a bit more like having your own business and more
Yeah,
autonomy and responsibility?
yeah, for sure. Yeah,
Yeah.
you definitely are the one to dictate what you want from your business, basically as a GP.
Yeah. And in terms of like sort of the specialty side of things, in the UK, my understanding is people do it's more sort of general consults. In Australia, where there's the procedure rooms and things like that in the clinics, people are getting more involved in specialties. Has that been your experience?
Yeah, here you're definitely encouraged to pursue special interests because that will, of course, diversify your work, make you more marketable, but also increase your earning potential. So it's definitely a thing to consider once you get settled here. I've been encouraged to look into, skin, like being a skin specialist because,
Hmm.
of course, skin presentations are quite common here, especially, Australia is like the highest incidence of skin cancers. So you definitely have a lot of work here to do to get into it. Also, you're encouraged to go into things like women's health. Um, you can charge for inserting contraceptions, for example, or occupational health. You can charge for doing workers' compensation. So there's quite a lot of things you can do to maximize your earning potential as a business.
And working in Australia as a GP, a full-time GP, which is about 40 hours full-time, depending on the practice, there can be flexibility around that. Would you say that the earnings are more than you would get working full-time in the UK?
Yeah, I think you definitely earn more working full time here as opposed to being a salaried in the UK. Some would say, yeah, as a locum, you would earn pretty much the same in the UK, but like we mentioned, you don't have the stability that you would over here. So it's definitely a big plus to work as a GP here financially than the UK.
Yeah. Okay. And the admin side of things there, how does that compare?
Yes, the admin side is definitely there's less of an admin burden here in Australia because the way it works is patients in Australia they're not obliged to stay with one GP or with one practice. They can actually register to as many practices as they want. So, for example, if they ask GP A to do a cardiology referral, they can go to GP B for a rheumatology referral, for example. So they kind of their work is spread out, whereas in the UK, you're kind of expected to deal with all the referrals and you're meant to handle all the paperwork for many patients. Also at the same time, like what we talked about before, you are expected to deal with admin with the patient present
Yeah.
during the consultation, and you kind of get paid for doing the admin with the patient
Yeah.
there.
So you don't have to do the extra time. And
Exactly.
the referrals and the overall healthcare system,
Mm.
is the turnaround time for those quicker?
Yes, for sure. I think because it's a semi-private system, patients can be seen much faster. I find generally actually talking to the secondary health, like secondary care professionals, are very more approachable. I think also because they would like to, build their own clientele. So in a way, there's like a mutual beneficial relationship between the secondary care doctors and the GPs, because they want to be friendly with the GPs, so the GPs can refer to them, the patients, to their private services. So there's like a mutual sort of respect, I find, between specialists and
Okay.
GPs. Yeah.
Oh, that sounds good. Any challenges that you faced while making the move?
I I think it's been pretty easy. I think because, Grace has been very helpful, and also Jordan has been very helpful. It was pretty straightforward. I think, like, one advice I would give people coming here is that you're pretty much you're a newcomer, so you can be easily socially isolated. So I would really encourage people to, in their free time, to get involved in different activities and to meet new people so that they don't feel alone. So yeah, that can be a potential challenge, but it can be overcome for sure.
Yeah. Because I've found myself, like, I've been out to Australia 4 times now, and yeah, I do think there's a lot more happens socially out with work,
Yeah.
and I think that's probably a lot to do with the weather. But yeah, there definitely does seem to be a lot more socializing. There's an amazing cafe culture. And even like people would meet up before they went to work, which is just not something that you would do in the UK. We'll just get sort of our heads down and we're going to work. So yeah, I
Yeah.
thought that was something that was really quite nice.
Yeah.
Work-life balance overall, any sort of feedback on that?
Yeah, it's good. I mean, anything that you want to do, they pretty much have it here, and the weather permits it too. So when I was in the UK, I really love swimming, but because it's cold all the time over there, like, it just doesn't put you in the mood to swim. But over here, like after work, like a few times after work, I just go straight to the pool, and because it's so nice and sunny. And of course, it's summertime now, but even in the winter, it's really mild. It just goes down to what, 15 degrees, which is still good. So
Yeah,
yeah.
yeah. It's interesting. You will probably acclimatise though.
Oh
You
yeah.
might acclimatise quite quickly as well, having come
Yeah.
from a hotter country
Yeah.
originally. So, because I
Exactly.
do
Yeah.
find that with doctors, yeah, they start to feel the cold a bit more than they did in the UK. 20 degrees here
Exactly.
is a lovely day,
Yeah. Summer,
certainly in
basically.
Scotland.
Yeah.
And so when you went out there, what did you do in terms of property? When you landed, what did you do?
So a couple of weeks before I landed in Australia, I went on a lot of websites. One of them was yeah. So I'm not sure if I should name it, but I went to a few websites, and I just sort of asked around, and I was quite lucky because I found this property which I've rented, and it's en suite, it's a studio, it's all inclusive. So I was pretty lucky. I did hear that there is like a housing crisis in Australia, but I think because we have a higher earning potential, it won't affect us as much. So we have more options to look for places that are more suitable for us.
Okay, so are you quite near the practice?
Yeah, I'm just a 10-minute drive from the practice. And one thing I realized is, similar to the USA and the Middle East, Australia is a very car oriented country. So the public transport is there, but it's not as reliable as London or the UK, for example. So yeah, definitely worth thinking getting a car.
Yeah,
Yeah,
yeah.
when you get here.
I think so too. And because there's so much traveling that you can do as well, it's
Yeah,
better to have a car.
yeah,
But what I found, you may agree or you might not, is that driving's much better than in London and the UK. I think there's not as much congestion and there's better parking. Would you
Yeah, definitely
agree?
in Wollongong. Definitely in Wollongong. Yes, I think that's the
Yeah,
beauty of being in Wollongong. The traffic is less, and parking. Yeah, you can park in the city center for free after certain hours. Whereas in Sydney, or like in London,
yeah,
any major city,
yeah,
yeah, it's more difficult for sure.
yeah. Sydney's a bit more challenging, definitely, but yeah.
Yeah, yeah, yeah.
Yeah. Well, thank you for taking the time to speak to me today. And yeah, obviously keep in touch and let
Yeah,
me know how things are going.
yeah. Thanks, Vicky. Thanks for the
No
opportunity.
worries. Thanks, Mohammed.
Thank you.